right. So, hello, everyone. Welcome back to another episode of the Wall to Wall podcast. Of course, once again, we're going to talk about some controversial topics. Controversy all the time. So today's topic is MAID in Canada. And that's
what is MAID?
What is MAID? Yes, when you say MAID in Canada, it's not exactly how it sounds. MAID is for medical assistance in dying. Yes. So what's going on right now in Canada is that, I mean, where do I even start? How about we start with showing that commercial?
Dying in a hospital is not what's natural. That's not what's soft. In these kind of moments, you need softness. It can take dying to figure out what living is actually like. I spent my life filling my heart with beauty, with nature, with connection. So I choose to fill my final moments with the same. Last breaths are sacred. When I imagine my final days, I see music. I see the ocean. I see cheesecake. Even now, as I seek help to end my life, with all the pain, and in these final moments, there is still so much beauty. You just have to be brave enough to see it. And seeing the rhythms of what's gonna keep going after I'm gone bring a lot of comfort.
So yeah, this is a commercial by Simon's, a retailer in Canada, somewhere that I actually shop at myself, but I don't know if I'm going to have to start rethinking that because it's kind of, I don't know. It's like, you know, wherever you put your money, that means that you're supporting them. But yeah, it's crazy because now before, you know, I think we can kind of get behind the idea of when people are like critically ill and they're suffering and they're near the end of their life. Does it make sense for them to suffer for an extra month or two when there's a solution to end their suffering earlier? I think
terminally ill people,
we can get behind that. But now it's become more accessible to people that are not terminally ill. It's for people who have chronic pain. It's for people with mental disorders.
Living in poverty.
People living
on disability.
I mean, you know, here we are in Canada where there is healthcare and social assistance. But this, I feel like this is just highlighting a very big flaw in the system, where instead of making sure that people are being provided with the adequate amount of health and care, and then the social assistance, so amount of income and a place to live, food, general well-being, instead of that, now the option is, well, I mean, to be a little dark, I mean, it's like, okay, well, is this more cost effective?
Yeah, it seems like, as you point out, a flaw in the system where, from a governmental or managerial point of view,
Yeah.
it's almost just a lazy decision, a lazy solution. It's easier just to get rid of the people that are burdening the system by being impoverished, or, you know, being on disability, or taking mental health resources.
Yeah.
So it's a tax, of course, but it's part of our human condition in our modern society. People like this exist. It's probably somewhere around 10% of the population
that's suffering,
ailed with either a mental disability, or maybe they're a veteran, or maybe they're just not they're a non-productive member of society, in that they don't have the ability to contribute, whether it's physically or with a skill or a trade. And they're not being valued by this system becoming more accessible. So that's the problem, right?
It just seems like they just want to get rid of them. I mean, you know, because you brought up veterans. I mean, there's this case, and we'll show it right here. But there's this case that where I can't remember how many, maybe it was 3 or 4 veterans suffering from PTSD or some other, you know, mental disability that they got from being in the military. The solution for them, when they're asking for help and assistance, you know, psychological assistance, they were offered help in dying. I mean, instead, yes. Oh. So that's, you know, yes, you know, in the news, I believe the prime minister and the leader, the governor general, and like the leader of the person in charge of people who are supposed to be helping these veterans said that no, we have to retrain this person. They're not supposed to do that. But I mean, it happened.
Yeah, they've started processes in, you know, making the paperwork.
And the option was available. So maybe this person shouldn't have presented this as an option to these people that were suffering. But the thing is that it's an available option for them. They can pursue this if they're suffering from a mental disability. I mean, I guess what the debate is, should people who are suffering this way, should they be given the option to end their life early, or should they be given the psychological help that they need?
Well, it's like you suggest. I mean, we have resources in place to offer to people psychological evaluations, resources in mental health, medical industry. And when they're reporting it in Canada, they're using Europe as a comparison where it's existed longer.
Yeah.
And Europe seems to have a lot more safeguards in place.
Yeah.
To evaluate people and to maybe offer alternative treatments first.
Yes.
Whereas in Canada, it seems like we're kind of rushing into it. We're kind of trying to streamline it and get a lot more people.
And it's quick. It seems like as soon as someone applies, they can be, you know, their application could be completed within 90 days.
Just like applying for a job.
You know, if you apply for a job for the government, sometimes you're waiting 6 months. This seems a little bit faster. 90 days?
Amir Farsood has applied for medically assisted dying, known as MAID. He lives in constant agony due to a back injury, but has started the process for end of life because his rooming house is up for sale and he can't find anywhere else to live that he can afford. He barely survives on Ontario disability support payments, which are just over $1,200 a month. He doesn't want to die, but being homeless is not an option.
I know in my present health condition, I wouldn't survive it anyway.
Farsood meets the criteria for MAID, physical suffering due to disability that cannot be relieved. His doctor, who knows Farsood's real reason for MAID is his fear of being homeless, signed off on the application in August. Farsood needs a second to do the same. There's a 90-day waiting period. He believes he could potentially access MAID in about a month.
Yeah, it seems like the cost is too heavy. I mean, okay, so, like I said at the beginning, if someone is suffering, like they're a cancer patient, they have a terminal illness, and it's just an ongoing thing where they're basically waiting to die, it makes sense.
Yeah.
Because they're not able to, there's no path forward. There's no available cure. They're just counting down the minutes or the days, maybe the weeks, so I can appreciate those people making that choice. But then you have these cases where there's a woman who's suffering from physical pain and allergies. She's unable to work. She's on disability, but her living situation is so terrible that she's suffering daily. Really, the solution for her would be to find her a better place to live. Simple as that. But because housing is an issue for people on social assistance, instead of trying to find her appropriate housing, she's given the option of death. How is that a solution? And yeah, okay, Canada virtue signaling that they're accepting of death and all of that, but then it seems like a step too far. I mean, there's nothing virtuous about it.
What we're seeing now is perhaps, or what we can observe right now is that it's a value of death over life.
Yeah.
So then we talk about suffering. So what's the threshold of suffering that makes it appropriate to grant them death?
That's a very hard thing to know, because I think you don't know how they're experiencing suffering.
For example, maybe somebody with depression. At what point is that suffering reasonable to offer that person, like chronic depression? There's situations where they've gone through treatment, years of treatment.
Yeah.
And maybe they're at wit's end and they are suffering and they don't see.
Okay. Yeah, I see where you're coming from there. Okay, so there is another case. If I can find it, we will put it right here. But there is another case where there's a man, I believe he's in his 70s, and he's had a family. I believe he's had kids, and he's been suffering with depression his whole life. And he's pursuing MAID. He's pursuing medical assistance in dying. But he's in his 70s. He's gone his whole life. I can only assume that he's gone through multiple treatments, that he's tried medication and nothing has worked. I feel like I can't say, how long, like how much suffering does someone have to endure before that decision becomes a viable option. I feel like it's more acceptable. I can't say that it's good. I can say that maybe it's more acceptable for someone in their 70s who's gone their whole life suffering. But this is the problem with how it works right now, is it's not just available for people who are seniors. It's available for people who are younger, who could potentially have a lot more time to live, who could try different treatments and therapy before this becomes an option.
You shouldn't be offered an ultimatum of homelessness versus death.
I mean, and then, instead of being made to live in poverty or live in the wrong kind of environment for their needs, the option instead is, okay, here, sign this form, fill out this paperwork, and in 90 days we'll help you end your life. Sorry.
The troubling factor too is with that Simons ad is the glorification of medically assisted induced death. There is a spiritual aspect of it. Death is part of life. We're all gonna die eventually.
Yeah.
But it's It's the fact that it's glorified like a fashion statement, or like you're being a martyr in some way, or you're virtue signaling that you're, you know, more spiritual than you're letting on simply because you're accepting death. But under what circumstances is it appropriate for you to accept your own premature death?
It feels like there hasn't been enough. Like you haven't given it enough time.
Mm-hmm.
It's like the government is saying, it's like, okay, well, you know, we're ready to give up on you if you are. Like, what?
That's a good point. Yeah.
It's like,
and then
it's like it can go even further. Like, how young are we gonna go? This is a slippery slope.
That's a good point.
This is a slippery slope.
Young people.
You already have young people who are suffering and they take their lives. And now the government is saying you're suffering mentally and you don't have to take your life anymore. We'll do it for you.
More Canadians now have access to a medically assisted death than ever before after the controversial Bill C-7 was signed into law late last night. Now, previously, death had to be reasonably foreseeable for you to be granted what's also known as MAID. That isn't the case anymore. It's left some people furious, while others are breathing a sigh of relief.
That's a slippery slope. It's dangerous.
There's a few marginalized groups that we could draw connections to. They're susceptible,
ostracized from society,
to taking their own life. And then in Canada as well, we have northern communities of people who are also statistically more susceptible to taking their own life.
They're suffering. They're in isolation.
Right, so they're remote and they don't have access to as many amenities or privileges as the rest of the population close to the American border does.
It's like they're saying that life doesn't have value. What has happened to the value of living? Like, your life doesn't have value. We can't help you. You can't help yourself. So here's a way that's going to save you time and us money. I mean,
that's what it really appears like.
It seems that way. You know, it's one thing for someone to be, we'll say it again, it's one thing for someone to be suffering from a terminal illness, but it's another thing for someone who's suffering with a mental disorder, depression, post-traumatic stress disorder. And instead of offering as much help as possible, instead of exploring every option available, it's like, let's help you die instead. It's like they're saying we don't have a place for you in society. It's like,
so just give up.
That's dark. That is so dark.
Now, it's, you know,
I think it's too easy. They've made it too easy if people in poverty and people who are suffering just because they're in the wrong, just because their environment is causing them suffering.
Right.
Because for a person like that, when their environment is causing them suffering, the first option should be, let's find you somewhere else to live.
Yeah. Improve the environment before.
Yes, that should be the first option. The policy in place now allows for people who are just suffering in their environment to choose this option. That is dangerous.
Right.
I don't know how else to say it. Like,
it becomes part of a bigger picture issue.
Yeah.
Where taxpayers in a socialized system are forced to foot the bill of paying for the resources and amenities for all these people that need care.
Yeah.
That becomes a question of, how are we distributing the money? How are we distributing the resources?
Yeah.
There should be a sustainable model. We should probably reevaluate. We seem to have maybe rushed through the model, and there are a lot of holes in it.
It's a scary thought. Is this a cost-saving measure?
Is it a conspiracy leading to population control?
We can go on about that. So So what are we saying? Are
We're
we saying that, like, you know, here in Canada, our socialist society where people are on social assistance and living in social housing and getting all those benefits, if you get rid of the people who are suffering from depression and poor that society has to pay for, maybe it'll save the government a lot of money if they just allow them to end their lives early? Is it this some kind of dark conspiracy theory?
The bourgeoisie trying to get rid of those poor people. Yeah, we're just throwing out ideas. We're not saying one way or another. It's just, where are these ideas coming from?
Where is it coming from? Where's the line? When does it stop? We don't know. Obviously, there's more to discuss on this because it's, you know, it's happening now. The policies are being discussed. What's going to change? We don't know. I guess we'll have to wait and find out.
Until next time.
Until next time.